ma'am. I am Shahudati Abang, a third-year student from the Respiratory Department of Universidad de Zamboanga. So first things first, may I know your name, ma'am?
Asha Kayla Uddin.
What's your birthday, ma'am?
March 4, 2004.
Okay, so age po?
I'm 21 years old.
Okay. The procedure that we will going to perform today is about assessing the thorax and the lungs. So before we perform the procedure, may I know if you have a family history of illness, including the cancer,
No po.
allergies,
No din po.
okay, tuberculosis,
No din po.
okay, lifestyle habits like such as smoking,
No po.
okay, any medication being taken,
None po.
okay, okay. Meron po ba tayong mga current problems such as swelling, coughs, wheezing, or any pain?
None po.
Okay, okay. Good to hear. So, okay, let's start with the assessment. So, particular start with your posterior thorax. I will perform hand hygiene. So, we will inspect the shape and configuration and any visible abnormality. Inhale, exhale. Inhale, exhale. Inhale, exhale. So the next is, we will palpate for the tenderness and sensation. So allow me to palpate, ma'am. Do you feel anything?
No po.
I'll be also inspecting temperature using the torso part of my hand. Okay. So, as for scapula, it is symmetrical and no abnormalities. And the shoulder and the scapula, it is horizontal and there is no scoliosis or kyphosis have seen. So the next one is I will be palpating for premitus. So using my ulnar part of my hand. So as I touch your back, ma'am, can you say 1, 2, 3? Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
So as for premitus, so I can feel the vibration as I put my hands up the vibration. So the next is I will observe for the chest expansion. So I'll just using my thumb and I will just observe my thumb. Okay. So inhale, exhale. Inhale, exhale. Inhale, exhale. So the next one is I will percussing the intercostal base of the patient. So allow me to percuss. So as I observe the resonance, dullness, flatness, when I percuss the patient's back. So I will percussing and performing the diaphragmatic excursion. So here, I have a pen here. So I will coach the patient to inhale and exhale and then hold. So okay, allow me to touch, ma'am. Inhale, exhale, hold. Okay, inhale, exhale. Inhale lang. Okay, inhale, hold. So the next step is I will be auscultating the patient's breath sounds if is there any possible or abnormalities. So okay, I'm using the stethoscope. Inhale, exhale. 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 Inhale. Okay. The next is I will auscultate the voice sounds over the chest wall. So as I put the stethoscope on your back, ma'am, can you say 1, 2, 3? Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
So next, ma'am, I will be auscultating for egopony. Can you say E when I put the stethoscope on your back?
E, 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 E.
So, I will be auscultating for the whispered pectoral loci. So, as I put the stethoscope on your back, ma'am, can you whisper? So, as I auscultate my patient's breath sounds, I didn't hear any adventitious sounds like crackles, whines, or coarse. Everything is normal. So next, we will proceed to assessing the anterior lung of the patient. So I'm gonna inspect my client's breathing patterns, observing for its symmetry and rhythm. Using stethoscope. So as I put the stethoscope on your chest, ma'am, can you inhale and exhale? Inhale, exhale. 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 So as I inspect my client's breathing pattern, so I didn't hear any adventitious sounds. Everything is normal. So next, we're gonna be proceed for next and expansion by placing my hands to the lower thorax of my patient. So as I put my hands, ma'am, can you inhale? Inhale. Again, inhale. Exhale. Inhale. Exhale. So next, we will gonna palpate for tactile primitus as the same pattern for posterior thorax. Okay. As I put my hands, ma'am, can you inhale and exhale? Mm-hmm. 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 So next, we're gonna percuss the anterior chest systematically from the clavicle to the diaphragm. So, okay. Then lastly, we will gonna auscultate the trachea and then anterior chest using a sequence that follows in the percussion pattern. So, as I put the stethoscope on your trachea, can you inhale and exhale, ma'am? Inhale, exhale. 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 Okay. So, as I auscultate my patient's trachea and anterior chest, I didn't hear any adventitious sounds like crackles, fine and coarse. Anything is normal. So lastly, we will gonna document the detailed findings of our client's record to the attending physician.